Federal Ministry of Health is set to launch a community-based health research, innovative training and services program to enhance posting of resident doctors to rural areas. This initiative will address the required skilled birth attendance services in primary health care facilities across the 36 states of the Federation, plus the Federal Capital Territory in a phased manner to improve access to health services within the benefiting communities. The report.
The availability of skilled health workers in primary healthcare facilities at community levels is critical to curbing maternal, perinatal, neonatal, morbidity and mortality. But the goal to attain adequate healthcare workers is still underway. But the CRISP innovation, a partnership between teaching hospitals, federal medical centers, National Primary Healthcare Development Agency, state primary healthcare boards, local government health authorities and communities, is aimed at provision of support to attain adequate healthcare workforce at primary healthcare centers. The Executive Director, NPHCDA, Dr. Faisal Shoaib, says the intervention focuses on increasing, retaining and improving the quality, adequacy, competency and distribution of a committed multidisciplinary primary healthcare force that includes facility outreach and community-based health workers supported through effective management supervision and appropriate compensation.
This means that the CRISP resident doctors from the engaged teaching hospitals and federal medical centers will be deployed to the primary healthcare facilities to support service provision and on-the-job capacity building of primary healthcare workers.
The country representative World Health Organization, Dr. Walter Malumbo, said the initiative is timely as the WHO has declared the end of public health emergency of international concern for COVID-19 pandemic and is insisting on a collaborative approach for all key interventions because pandemic starts in communities and ends in communities. Hence, reliable data, evidence, policies and actions are needed.
Calling for member states to consider lack of access to vaccination as human rights violation. Women dying while giving birth should be reported as human rights violation.
Also, the UNICEF country representative Christian Munduate, who was represented by the Chief of Health, Dr. Eduardo Saledes, noted that neonatal mortality has not been reduced, and despite the problems, less than 5 mortality is still prevalent where 1 out of 10 children die before the end of 5 years.
For pregnant women having access to a skilled birth attendant during the moment of delivery, the national average is 51%, so it's 1 out of 2 women. But however, this hides a lot of inequalities within different states and even within the states.
The community-based health program focuses on addressing the human resource for health gaps in primary healthcare centers across community levels in the country. Aisha Salihu, Trust TV News, Abuja.